This meeting was conducted and recorded on the lands of the Jagera and Yugambeh people, and we pay our respects to traditional owners past, present and emerging, and acknowledge that sovereignty was never ceded. Hello everyone, I'm Andrea, former registered nurse and midwife in private practice. Welcome to Beyond the Rona, where we're going to be doing some brainstorming with you all every fortnight to figure out the best ways to help our community build back better now that we're starting to turn the corner and come through the other side of the COVID-19 pandemic.
And I'm Tim, I'm a digital marketer and business owner. Beyond the Rona is our chance as a community to participate and have our say in the issues that affect us all. So we all believe that collectively we've got more power than we realise to actually make the changes that we want to see in our communities. You can listen to Beyond the Rona on Apple Podcasts, Google Podcasts, or wherever you download your pods, and you can watch us on YouTube and stay up to date with us at beyondtherona.com.
Today we're talking to Dr Joan Carlini, a researcher from Griffith University who conducted a study a year ago into human behaviour and COVID-19. And also Kirsty Petersen, who's a family law mediator and community advocate in Logan, Queensland. Welcome to you both.
Thank you.
Thank you, Andrea and Tim.
So your research, Dr. Carlini, I had a look at it last night. It was done in August 2020 in Queensland, Australia. And I just had a look at the conclusion, actually, and it said... I'll just read it out. It said, in regards to receiving the COVID-19 vaccine, almost 70% of participants agreed that they would accept the vaccine, with only 18% refusing it due to concerns raised over side effects, quality of testing, and speed of vaccine development. So it seemed that we already knew what the problems were with vaccine hesitancy, like back in August 2020, yet nobody really did anything about addressing vaccine hesitancy and how were we going to, how were we going to raise these rates of vaccine, how were we going to address these concerns in the community? We knew what the problems were, but did nothing about it. Are you surprised with the fact that nobody addressed these concerns in the time that we've had?
Yeah, look, Andrea, it is really interesting. So the research was conducted a year ago and a lot has happened in a year, around the vaccine rollout and, different outbreaks. But I do believe that that research and the findings are still current, and it's definitely in line with research that's coming out of America as well. So there will always be a group of people that are unlikely to have the vaccine. As well as, other groups that are fully vaccinated, groups that have had one vaccination, as well as groups that are interested in having the vaccination. Yeah, look, I do believe that the government and the media hasn't really used the research that we've conducted and lots of other people have conducted in a useful way to help inform the community about what their concerns are. Instead, they've been focusing on, micro issues and political gain and other things instead of really focusing on, consumer psychology, what health consumers are thinking about, and helping them to understand the importance of vaccination and the likely side effects.
Yeah, and when you say political gain, I mean, we had a health system, we had ways of getting this flu vax, out to all of our communities, and yet, I'm not sure why, but instead they decided to use the Defence Force to roll out, the flu vax. I mean, and this might be why we've had problems with the disability community, for example, that instead of using the health system to get the disability community vaccinated, they decided to use the Defence Force, which they didn't even go into the disability care homes to give these vaccinations. It's been a real problem.
Yeah, look, I totally agree, but I think it comes from the mindset that, this is a war on corona, And so what do you do in wartime situations? You bring in the military, okay? So it probably has a lot to do with the psyche of our leaders and how they're approaching this. If they took like a more ground-up approach, more of a health service approach, they would definitely have approached this differently. And then when we find out that, workers in aged care facilities were not priority for vaccination, and then we hear stories around like a young person I know who lives with disability not being vulnerable enough to have to qualify for the vaccine. There's been so many issues along the way, and then all of a sudden we're being told our vaccination rate is too low. Roll your sleeves up and get vaccinated.
Yeah.
That's on us. But in actual fact, from the very beginning, the rollout has really been flawed.
Yeah.
They really do need to listen to the community, put measures in place, really listen to understand what the issues are and act on those issues rather than having this steamroll approach, because we won't get to the vaccination targets that are required with this approach.
Yeah, and it's been really, really difficult, I've noticed, and especially from a health professional point of view. Some of the difficulties I've noticed is for people to actually understand how to make an appointment, to know, at first we will put in these 1A, 1B, all of these groups. People didn't know exactly, when these groups were coming up, when it was their time to go and get an appointment, and there were really strange infection control practices coming out from people who, small businesses who didn't really know anything about infection control, and they were putting all these infection control practices in their business that, really didn't make sense. Kirsty, did you notice anything like on the ground in Logan? I know that Logan is considered like a lower socioeconomic area, and, they did have higher rates of COVID in these areas. Did you notice anything on the ground where, people really needed a little bit more help to understand the system of how to get a vaccine and how to understand infection control and, I suppose being a multicultural area as well? Could the messaging have been a little bit better?
Yeah, I think the thing that I really noticed and that I was certainly hearing in Logan, and let's remember Logan has 270 different cultural people from different cultures. So we're a hugely diverse cultural city. And I think that's the other thing that gets lost too. Logan is actually a city. It's not a suburb of Brisbane or the Gold Coast. It sits alone as its own city. So people were saying exactly what you said. Even if they knew that they wanted to get it and had registered, they couldn't get it, or there was a very long wait to get it, and then they didn't know where to go to get it. The Logan City Council was quite proactive and opened up the Logan Entertainment Centre. So it provided a large facility, but then there was a shortage of supply. So a lot of the time it's the messaging. You think the story that is in the community is there's a facility that's available, but there's not a lot of supply. So if you go there, you're not going to get it anyway, so why bother going? So again, it's about that sort of messaging that's walking around in the community. But I will say that the thing that the state government did very well was see what had happened in Sydney with its diverse communities. And shortly after that was very publicly displayed and discussed. They did reach out to local leaders in the Logan community and start working with individual sections of the community and the local leaders of those communities. So what I heard at the time was that those leaders were quite grateful and pleased that the government had reached out to them and were involving them in motivating and mobilising their people to understand what was going on, because that was what we were hearing a lot too coming out of Sydney, is that those communities didn't know what was happening. They had come from often countries where if somebody turns up at your door, that's a bad thing. So seeing the police around, seeing the Defence Force on the streets was quite problematic for them. So what I heard was that at least Queensland was looking and seeing what had not worked successfully in other places and started to make some changes. The other thing that was confounding is, again, for the disability community. A lot of what I heard from the people that I know is that there were people that were unable to get the vaccination and then confused about what that meant for their household, what that meant for other people that they knew, and there wasn't a lot of information around that. So the fear around would they be safe or what would happen if they were not able to get the vaccination was very unclear as well.
Okay.
So just the messaging in general was difficult on the top, and then as it filters down, it becomes even more distorted in the community.
Yeah. So Tim, what do you think could have been done better, do you think, in terms of like messaging? Maybe, I mean, you saw the TV ads that the federal government eventually brought out. Maybe people talked about role models getting vaccinated at one stage. Do you think that might have worked to address vaccine hesitancy? What do you reckon?
Yeah, kind of like in the US, right, where they were using TikTokers and celebrities and whatnot to endorse. Yeah, and like I think as well, just even from a digital standpoint and using social, like it feels like the government has been really slow. And this is like kind of across the board, but also getting on the front foot when you've got so much misinformation that moves so much faster. And I think it's not just unique to COVID and vaccines, but you see this in so many different areas where disinformation just moves so quick. They can author it, they can share it, and they can make it reach people, masses of people, very, very quickly. So it's almost like we kind of need a specialist, response team in at local level maybe and at state or even federal level that is actually able to move quickly. Because I understand that, we need to know all the facts, we need to know this, but it just slows everything down and just creates a vacuum whereby the misinformation moves in and suddenly creates this really bad situation in society.
Because it's about mobilisation, isn't it, too? Lots of people can send a text message to all their group of people who have an idea, and then everybody gets on. And we saw it with the bushfires as well. Lots and lots of rhetoric around who was to blame, what the problem was. Then there was this discovery that the Prime Minister was not in the country, he was on holiday. And then that went, I was going to use a fire-related, but probably not so great choice of words. But that went viral as well. So you're totally right. The inability of the government to mobilise quickly and broadly to offset what social media does really well, but in the negative by sharing the disinformation, does have a big role to play in, I think, a lot of the vaccine hesitancy.
Yeah, I think we not only had, problems with, I think one of our main problems was mistrust with the government as well. I mean, we not only had the anti-vaxxers in our ear, but we had the mistrust of the government. At the time, we had all of these, problems with, not the Me Too movement, but problems with women and the women problem with the Liberal Party and all of that stuff coming out as well, and sports rorts and all of that stuff coming at the same time. So then, when they put all their money into Pfizer, knowing full well that we didn't have the capability in GP clinics to actually keep it at minus 70 degrees where it needed to be kept cold, and then rural places weren't able to store it at minus 70 degrees. But the reason why they chose Pfizer was because, the reason why they chose AstraZeneca was because it was cheaper. That created a lot of mistrust as well. And then, it kind of blew up with the blood clot thing and then people didn't want to have AstraZeneca, and then they said, oh no, now you can have AstraZeneca. There was all that confusion in that messaging as well. So then people didn't think it was tested properly, and there was a lot of mistrust. What do you think, Joan?
Yeah, I think in general health literacy is quite low. So generally in the community we don't really understand health information, and that's why we do need to work really hard to make sure that that health information is simple. But then when you throw in, distrust of government, and certainly the actions of the government that we see hasn't helped. One example might be that we have our hard border shut, with Queensland, and which has caused immense hardship for a lot of people, not just on that border, people trying to get to our tertiary hospitals to get care, all sorts of issues. But then, we pay, millions of dollars for a sporting event, and we fly, these sports athletes into Queensland as well as their families, and quite often they're seen doing the wrong thing as well, taking drugs in public places and whatever else. People are really angry, so there's a lot of people that are doing the right thing, and they should be commended for doing the right thing. They're following the government advice as closely as they can. But then when they see this, that they feel like they're being taken for granted. So it's not really simple. There are so many factors. Yes, it's our understanding and misinformation, but also the government needs to be consistent in their actions and make sure that, they make everyone feel respected.
And there's that backpassing too from levels of government. So I was listening to a podcast the other day of a high-ranked LNP minister federally, and all they talked about was the difficulty of being between the two jurisdictions, both federally and state, and how that has been just so traumatic for the federal government, because even when they had similar or the same political philosophies, there's different political motivations. So what's motivating the federal government is different from what's motivating a state government, and then again very different from what's motivating a local council government. And certainly what I've seen in Logan is that the local council government, who is focused on its local communities, has done a much better job than any of the other levels of government. But the buck passing, every time there's something that goes wrong, the state government says, oh, well, the federal government didn't do this. And then the federal government said, oh, but if only the state government would have let us do or whatever it is. And I think that's some of the problem too that we've seen with the police and the Australian Defence Force is ADF are under federal jurisdiction and police are under state jurisdiction. So again, there was little coordination between the two. And what we saw was this huge overkill, and then people are worried and scared because you've got the Defence Force roaming the streets, which we don't see that in Australia, and you've also got police with a huge presence on the streets, again, which we usually don't see in Australia. Police come in their flashing vehicle and they do what they do and then they leave.
Yeah. Kirsty, can I add to that? And we've seen that on the news in Sydney and Melbourne, the police and the armed forces on the street. And I actually think that this has led to another problem. Not all the people that are rioting and are not vaccinated, they're not necessarily anti-vaxxers, they're pro-choice. And so this has actually brought in another issue. When people are being labelled anti-vaxxers, I really don't think that's very fair and really unhelpful as well, because within that group of people who are not vaccinated, there might be some people who truly believe they don't want to be vaccinated. But then there's another group of people, like I said before, that are really cautious. They don't want to, harm their unborn baby or their ability to reproduce in the future. And we have examples of, where medicines have been approved and caused deformities in, children. So, there are examples where we have trusted different medicines and, I guess, things have gone wrong. And also, just like I said before, pro-choice as well. Like, people are really not used to being told that this is the way you have to act, and here we've got the armed forces in the streets to making sure you comply. And so that frustration of, mental health issues, problems with their economic, they don't have money coming in. I think this is all just boiled over and people are rioting. It's not necessarily got to do with, I don't want to be vaccinated. It's got to do with, what about me? Look at me. I'm really struggling here.
Is this the first?
And a lot of the time they just don't want to be told what to do.
Yeah.
Exactly what you've said.
Is this the first time maybe that people have really started looking into the vaccination schedule? I mean, people have just kind of lined up their babies for all these vaccinations and never really thought anything of it. Yeah. I mean, is this the first time they've actually thought about it? I mean, what about Gardasil, for example, and what about, rotavirus and all these other new vaccinations that have come in? Nobody's said anything about that. Nobody's, protested in the street about these other new ones. That's
right. It's a combination of factors.
Yeah, it's strange to me. Okay, so I guess, what do you think could have been done differently, Joan, do you think? How do you think it could have been managed differently?
Is this my 3 big ideas, Andrea?
Yeah, I guess so. Yeah. What are your...
Yeah, look, it's never too late, right? So first of all, I think we just need to understand what's happening a lot better. The research that we're talking about that I conducted with my team is a year old now. I think it is still valid, but I think we could be doing more research, and I'm sure it is being conducted. But also just looking at that research to understand what's going on. Like I said before, I've got onto research coming out of America because it's really current, and they do spend a lot of time doing their research. I would be absolutely using current statistics to understand what's going on. Like I said before, there's a group that's unlikely to get vaccinated at this point. Well, that's okay. Start focusing on the cautious and the interested. And they are 2 different approaches. So the mass vac centres that are opening this weekend and this massive Pfizer weekend, that will help the interested people get vaccinated because you do that via reducing barriers, increasing access, and reducing costs as well, so people don't have to be off work, or if they can do it on a weekend and they don't feel well, they can stay in bed and, they don't need to go to work the next day, or, their kids are at home as well. So that's a really important strategy. So well done on, ticking that box. But also this cautious group, I think, is a real concern because they're validly concerned about their health and the health of their family. And so we need to think more carefully. We need to do more research into this group. It should be a fairly small group of, 8% in America. And like I said earlier, our statistics are in line with theirs. So we could expect it to be about 8 to 10% in Australia. So they're going to need understanding. So let's get in and understand this particular group. In America, it's mainly women who are concerned about their fertility. So we need to understand, what their concerns are, have them book into their trusted GP and talk to their GP and really understand what the side effects are and have a chat. We're focusing on Pfizer and AstraZeneca. There's a whole range of other drugs coming onto the market as well. I don't know the technology or the medicine behind them, but maybe if we could unpack, because this group is really interested, so they're willing to take in a lot of information. Maybe we can unpack that for them. Well, this is what these different drugs look like. And also, one of my way forward is to really look at what's happening internationally. I think, like many people, I'm really tired of hearing what's happening in Sydney and Melbourne. I know it's important, but I don't need to know every day what the new case numbers are. That is actually really not helpful. I want people, commenting from the UK. I've got friends in the UK. They're going to work. They're going to the football. The stands are packed. I want to know how many cases are in the UK, how many are vaccinated, how many are unvaccinated, how many of those are going into ICU, then how many are going on to ventilators. I want to see what the future is. And, countries like Italy that were ravaged, well, how are they coping? What have they done? Has that been successful? And then there's other countries that are actually up to booster shots. Well, that's of real interest to me. We haven't hit, we're at, between 50 and 80% to vax in Australia.
Yeah, Queensland is up to 50% now. Yeah.
Today, yes. But other countries are having booster shots. Well, what does that look like? I'm interested in that as well. Like, is this something that we'll require? Will our international travel be dependent on these booster shots? So I just think that there is so much readily available information that could really help Australia and Australians, and really help us understand what we should be doing and in which direction we should be moving. We're like, oh, okay, let's celebrate, we're going to move into home quarantine. Great, but what's down the track? What are other countries doing that they can take the public transport to work and have massive football, matches? What does that look like? So for me, that's the steps forward. Number one, understanding what's going on. Two, reducing barriers and providing information for specific people. So a deep understanding of their concerns. And three, in looking ahead, really looking to these other countries and really simplifying that information and bringing it back to Australia within case studies. This country's doing this is what's happening. That's it from me.
Yeah, and Kirsty, I think maybe, I'm not sure whether the giant hubs were actually a good thing, or whether we should have actually had, smaller health hubs that might have helped in our particular community, so that we could have had more one-on-one with like the multicultural groups. What's your opinion on that one, or what do you think about that?
Yeah, there was a lot of difficulty getting appointments locally. So, and a lot of sharing of information in local groups around, I was just at this medical centre and got mine, and they said they have appointments. This medical centre is taking new patients, because there was misinformation around that as well, that you couldn't just turn up to any GP clinic, that you had to be a previous patient of that clinic. There was information around, don't go to this one because they'll charge you extra on top of the Medicare rebated appointment. So you have to have a consult first, and it's a long consult, and they'll charge you this amount, and then you can get your vaccine. So there was a lot of information being shared in local community groups. But it was hearsay to a degree. So whether it was reliable or not is unknown. There's no evidence to suggest that it wasn't reliable, because it was everyday people getting on saying, this was my experience, this what happened for me. So when it came to the large entertainment centre or local GP clinics, again, it was just about information. Yeah. And I think that's one of the things, if I go into my three, all the things that Dr Carlini has said are so vitally important. But I think one other aspect of that too is, I've heard a lot in the local groups and from local community leaders about treatment. So what happens if you get diagnosed with COVID-19? When Queensland gets COVID-19. So at the moment, there's small cases. The health system doesn't have a lot of pressure around patient numbers. But once COVID comes into Queensland and it's spreading throughout the community, what is that going to look like for us? Are we going to just, go to the fever clinic and do the nose swab and then go home and wait to die? Or what point do we ring the ambulance? And these were some of the things that we were seeing in Sydney. People didn't know when to ring the ambulance.
That's right.
They didn't know, they were hearing that if they went to the hospital, they'd be turned away. So again, sharing of information, having the plan very well known. We see the ads for it's storm season, have you got a plan? It's about to be COVID season in Queensland, and nobody knows what the plan is. And again, just going back to treatment. So there's lots of information about treatments that are being used overseas, and feeding into some of the vaccine hesitancy. You hear a lot of, well, I'm just taking my vitamin B and I'm trusting my immune system. And some of that is not incorrect, because the healthier you are when you get COVID, then the stronger your body is to be able to fight it off. So some of these competing ideas are actually not in competition with each other. And again, it's just about information. So if you get COVID, what are you going to expect? What can you do to strengthen your immune system and, to be in the best physical condition possible when COVID hits Queensland? Do we all need to go and lose 10 kilos before COVID? Is because we know that obesity is a comorbidity. So, is that what we all need to do? Or do we need to take the vitamin C tablets? Do we need to, just drink 20 cups of water a day? What sort of things can we do to prepare for the COVID onslaught? Because they tell us what to do to prepare for storm season. Yeah. They tell us what to do to prepare for cyclone season in other areas of Queensland. But nobody's talking about what to do to prepare for COVID. Yeah. They're not telling us what it's going to look like. We've seen in other jurisdictions that when it does spread throughout the community, there's certain demographics that are impacted, and what happens then? Yeah. So, what happens when a mother and a father in the same home are both in a hospital? What happens with the children? Who's paying the electricity bill? Do they get out of hospital and come home to no water or electricity and a resumption notice on their front door because they haven't paid their mortgage for 6 weeks? None of these questions have any answers. And so people are scared, people are worried. And when you don't have answers to the questions, again, the misinformation starts spreading. Because I heard that this is what happens, or I heard this. And so on the ground level, the grassroots conversations spread like wildfire.
That's a really good point, Kirsty. It's very, very interesting that actually there should be more information about when it happens, because I was at a health conference a few days ago, and what was said was every day that Queensland is without Delta is a gift. And I take that as, it will be here, like you said, and it will spread like wildfire. And that's a really good point. I haven't even thought about, what I will do when that happens. Yeah, so absolutely, and we need to know.
I plan to just shut my doors and stay home again. But it's like everybody is saying, COVID is an inevitability. Getting COVID is an inevitability. We need to learn to live with COVID. Yeah. Yeah. We're opening up our border to international travel for Australians and for there to be no restrictions on Australians coming home. And yet we've got no idea what that actually looks like. We don't know how to live with it. Exactly. No. Yeah. And you can do quarantine at home, but does that mean if I go overseas for 2-week holiday, let's say I go to Bali for a week, do I actually need to take 3 weeks off work because I have to quarantine at home for 2 weeks? Exactly. Or can I work from home for 2 weeks? So again, there's just all these questions around what does it look like practically, or tell me what's actually going to happen.
Exactly.
Yeah, the how.
Tim, I'm going to put you on the spot here. So how, when people are going through, Facebook or whatever, how are people supposed to pick and choose between what is good information and what is bad information when it comes to, figuring out what's a conspiracy theory and what isn't? How are people supposed to pick and choose and find the right path? Because if they are, mistrusting of government sites, of course they're going to head down the conspiracy theory way. So how are people supposed to find their way?
Well, I guess the good news is that there are a lot of teams and, kind of divisions and tech companies trying to figure that out, trying to help users make more informed decisions, because it is about kind of firstly digital literacy, but also just good old-fashioned research. So what some people are saying is, just making sure that there are a number of different sources and that those sources are known and reputable sources. So it's not just one voice from someone on YouTube that has 100 subscribers. I think it is about kind of making sure that there are enough sources, and I think that actually as well, where we get a lot of our news and where we get information, sure, it's in news feeds. And so news feeds on all the social channels need to be better at flagging that kind of stuff. They can already flag things like, this particular post is about COVID, so put, like government mandated, links and whatnot. But also just being able to also, make it really clear who the author is, whether that site that's connected to that is actually like foreign owned, or there's some movements happening there to just help flag content in newsfeed and help people understand a little bit more about these sources. This has been used in the past to spread misinformation, where fake sites or sites that have just kind of sprung up suddenly become highly active, and they get highly engaged, and so that content goes further. But I think it does start with that, and I was also quite happy to hear that schools are also trying to really address this and teaching kids and young adults about how they can be more discerning about what they see online. So I'm positive that I think we can get over this issue soon.
Tim, that's really interesting. It's like a nutritional panel, but for social media. A disclosure of the behind where that information comes from. That is a really interesting concept. I hope it goes further.
That we've got an element of that currently on some of the social channels. So at least on the Facebook, in the Facebook world, they flag. There's a tool called Ad Transparency where you can see, when an advertiser is running ads that would not normally be seen publicly. So they've got a level of transparency for advertisers, and for government it's even more. You can actually see the ad spend, that government is making. But what we aren't seeing at the moment is that organic content where you can post anything, and it can be from a WordPress site that you spun up last night, and it can be very controversial and get lots of likes and then go off, and there's no kind of like transparency around that. So I think once they've addressed organic content, we'll be in a much better place.
Okay, well, thanks for joining me, Dr. Joan Carlini and Kirsty Petersen. It's been a great discussion today. You've been listening to Beyond the Rona. Captioned audio is available on our YouTube channel. Don't forget to visit beyondtherona.com to listen to previous episodes or to get in touch. Catch you next time.